Hi everybody, I'd like to talk with you about your C-section that is coming up. I'd like to talk with you about what to expect before your surgery, during your surgery, and after your surgery. So what's going to happen is a couple of days before the St. Peter's pre-anesthesia screening will be giving you a call to ask you certain questions. They may be asking you to get your bloods drawn beforehand. Remember, this is major surgery, so they're going to ask you to have nothing to eat or drink 8 hours prior to your surgery. You're going to typically arrive 2 hours prior to your C-section, and you will arrive on the 3rd floor of labor and delivery. Once you get there, they'll put your IV in. If you're at a higher risk for having bleeding, they may put two IVs in, and hopefully at the right time, they'll be walking you back to the OR. In the OR, you're going to be sitting on the side of the bed and you're going to be curling over, and anesthesia is going to wash off your back and they're going to place a spinal. Very quickly, your legs will feel really warm and tingly, and we're going to lay you back down very quickly and tilt you over to your left side. We will then put a little pillow underneath your back so you stay tilted to the left side. We're then going to put a Foley catheter to drain your bladder and then wash off your belly with a prep called Chlorocept. It's alcohol-based, and so it'll turn your skin a little orange. Because it's alcohol, it's flammable until it's dry completely. So we will actually watch the clock, stand back, and let the paint dry for about 3 minutes before we put up the blue drapes. Once we put up the blue drapes, we'll do a timeout to make sure we have the right patient and the right procedure, and then we're going to pinch you really hard. And this is to test to make sure that your spinal is working well. You should feel pulling, tugging, pressure if the spinal's working. If the spinal's not working, then it'll feel sharp and pinchy, and so then anesthesia will ask us to wait a couple more minutes for the spinal to work. Once we know that that is working well, then your husband or your partner will come and sit at the head of the bed, and then we will start. We'll do the surgery, we'll deliver the baby, we'll hand the baby off to the respiratory team who will then suction out the baby's nose and mouth. We always tell people that there's always a small risk that the baby may go to the NICU because C-section babies haven't been squeezed out through the birth canal, and they can end up with a little bit more fluid in their lungs, and so that transition may be delayed, and so they may go to the NICU for that reason. It's very unusual, but it can happen. After we deliver the baby, we clamp the cord, we cut the cord, and we deliver the placenta. Once the placenta is delivered, then we do the repair. If you were having your tubes removed to decrease the risk of future ovarian cancer, then this would be the time that we would do that. And then we would do the repair. Two things make people feel really nervous that we need to warn you about. One is everybody experiences shortness of breath. Like you can't take a deep breath, and that's very, very normal. The reason is the spinal doesn't allow you to feel your chest while moving, and so your brain translates that as shortness of breath. The other thing is, as the baby is being delivered, we're going to push really hard on the baby to get the baby delivered, so it feels like there's a big elephant sitting on your chest, but that's us just pushing on your belly to get the baby delivered. So if everything goes well, then you can do skin to skin with the baby. And then once we're done with the repair, then your partner and the baby will go to the recovery room, and we get you cleaned up, and we follow in about 5 minutes. You stay in the recovery room for about an hour, and then from there you get transferred to the postpartum side. And you'll be at the postpartum side for about 48 hours. If everything goes fine, you should be able to go home in 48 hours. If there's issues with bleeding or your blood pressure, then you may stay longer. The risks of the C-section include bleeding, infection, damage to the adjacent organs like the bladder, bowel, or blood vessels. All of these things are very unlikely, but it is major surgery, so we have to tell you about them. Once you're over in postpartum, most people are given Motrin and Tylenol around the clock, and that seems to be sufficient for most patients. We also have oral narcotics like oxycodone and hydrocodone that we can offer you if you need that for better pain control. All right, so that's it. If you guys have any other questions, then we'll talk more in the office. Thank you.